Hi, my name is Tyler Patrick. I'm a physical therapist out here in Kona with Therapydia. Today I just wanted to talk to you about ACL injuries and what you could potentially do to help prevent one. Alright, so the ACL is basically a stabilizer of your knee. There's a couple of ways that you can injure it. One way is actually getting hit at your knee. You can hyperextend your knee, or the knee can actually pivot and rotate. The ACL stops all of those movements, and when your knee ends up into that position, that's when you can tear it. Our main goal in therapy is to keep you out of this position. So the way that we screen for that is we actually have you do a squat. When you do a squat, we look for multiple things, but I'm going to give you the three main ones that we look at. Alright, so there's three main things, like I said, that we tend to look for in our screening patterns, especially the squat. So the first one would be foot pronation. So what that is when the foot actually caves in, or some people call it flat feet. So when your foot actually goes into that position, you can see as I do it, my knee is actually going into that position. We call that position the position of no return. So when a person goes into a squat, if that knee comes in, it can actually be caused by the foot, or it could be caused by the hip. So another way that your knee could fall in is actually by hip internal rotation. So the hip's not stable, it falls in, and that's another way for you to end up in that position of no return. The third thing that we look for is if a person has a quad dominant pattern. You've seen a lot of people that do a squat, their knees just come forward, there's no hip usage. So one of the primary things that we try to do is get people to stick their butt out, using their hips to take that force off the knee and trying to avoid using a quad dominant pattern. So as a review, to avoid this position, you want an arch. So we have people screw their feet into the ground, build up that arch, externally rotate their knee to keep their knee over their toe, and then basically stick their hips back so when they come down into a squat pattern, they're not in that quad dominant position.